Hello and welcome to the EduTalk series hosted by Biotone EduPartner School Program, and massage industry experts. With the continued interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Tonight's expert is Binaifer Bugli. She's a licensed physical therapist with certifications in vestibular rehabilitation and craniosacral therapy. She is an instructor for the Upledger Institute International, teaching adult and pediatric level classes and workshops. Binaifer also educates the community and other professionals in craniosacral therapy, falls prevention, and vestibular rehabilitation. Binaifer is a past presenter for the EduTalk series, and you can listen to her previous talk on biotone.com under the EduTalk tab in the archive library. A link to that talk will also be included in tomorrow's follow-up email. Let's listen and learn as Binaifer introduces craniosacral therapy for pediatrics. Craniosacral therapy is not diagnosis specific and can help clients in all age groups. Binaifer discusses how craniosacral therapy facilitates progress from developmental delays, torticollis, latching issues, tongue tie, to many other conditions. Craniosacral therapy for pediatrics focuses on helping overcome limitations to grow and achieve full potential. So this looks like it's going to be a wonderful EduTalk. Thank you so much, Binaifer. Again, thank you everyone for your interest and joining us for the EduTalk series. And with that, I know you have a lot to get to, so I'm going to sign off. I'll come back at the end of your presentation and help with chats, and it's all yours. There you go.
Thank you, Donnell. And it's a pleasure to be speaking to everyone again. Thank you to Biotone for hosting this and allowing us this opportunity. And let me just share my screen. We're talking about topics that I could speak on for days. So I would really like to get started so I don't take up too much of our time just doing introductions. Okay. Uh-oh. Do you guys see a black bar on your screen, or is it, can you see my screen being shared on now?
Yes.
Okay. So let's get going. Let's talk a little bit about craniosacral therapy in pediatrics today. So this evening, what I'm going to do is do a little brief anatomy physiology overview of what really is craniosacral therapy. What is craniosacral system to start with? And then help us understand, get a glimpse of what we would be talking about when we mention pediatrics, and understand it from a craniosacral therapy perspective. And maybe talk about a few of the common diagnoses that you might come across that would be helped with this approach. So craniosacral system is a physiological system. It's responsible for production, circulation, and absorption of your cerebrospinal fluid, which is the fluid that nourishes your brain and your spinal cord, your central nervous system. And that central nervous system is what controls the rest of us. So in all, it really helps our overall health, which is why it's such an important system in our bodies. So if you look at this picture, are you able to see my arrow move on the picture?
Yes.
Okay. This picture is facing to the left of your screens, and it's a sagittal cut, which means the person's been kind of split in half facing to your left as you look at your computer screens. And the little dark blue lines are where you would find most of the cerebrospinal fluid circulating around. It's usually produced in the ventricles, the spaces of the brain, within the brain, and then it flows out in between the layers that surround your brain and your spinal cord. And if you think of anything in nature has rhythms, right? And we talk a lot about the craniosacral rhythm when we're using craniosacral therapy as a modality. But really, there are so many rhythms that we have in our bodies. And all of these biological rhythms are what helps us with homeostasis, what helps keep us healthy, and they are fundamental to our well-being. So if you think about cardinal rhythms or diurnal rhythms, where, you know, why do we all fall asleep at approximately a certain time within a 24-hour period? Some people have a 36-hour cycle. There's rhythms in nature. You have your days and nights, seasons. You have the rhythms of the waves, tides in the fluids around the earth and within our bodies. In craniosacral therapy, the focus that we have is on palpating a rhythm, which Dr. John Upledger called the craniosacral rhythm. So this palpable craniosacral rhythm seems to be expressed in all parts of the body. It can be felt everywhere on the body. Unlike your cardiac rhythm, which you have specific pulse points where you would feel it. And unlike your breathing, where you can hold your breath, or you can learn how to control your heart rate by elevating it if you exercise really hard, or just meditating and calming your heart rate and your breathing down. Craniosacral rhythm is a pretty stable rhythm, and usually it doesn't voluntarily change its rate. There are a lot of theories and thoughts on why the craniosacral rhythm is produced, and why is it that we can feel what we feel under our hands. It's a very subtle rhythm. In about 100 years ago, Dr. William Garner Sutherland, he described a rhythm called the primary respiratory mechanism. And that rhythm, he believed, was due to the pulsatile nature of the brain tissue. In the early 70s, Dr. John Upledger he got together and led a team of physicians and biophysicists at MSU, and they proposed the pressure stat model. The pressure stat model focused more on the neurological regulation of this rhythm. And he proposed that there were stretch and pressure receptors within the suture material of our skulls, and those are what controlled this rhythm and created this palpable sense that we can feel. Now, a lot of rhythms are controlled at the level of the brainstem, which is kind of a junction between our brains and the spinal cord, right? And things like cardiovascular rhythm, our body temperature, our breathing, all of those centers are around that area. So recently, the research director at Upledger Institute, Thomas Rasmussen, formulated a theory called which he calls the pacemaker theory. And he believes that that is a more current biological explanation for why and how the craniosacral rhythm is regulated in this brainstem area. So looking at this picture that we had seen earlier, if you look at this little circle, that's around the level of the fourth ventricle. And he believes that there are neurons at the base of the fourth ventricle, around the floor of the fourth ventricle, which help regulate our craniosacral rhythm. So we've talked a lot about craniosacral. Let's talk a little bit about pediatrics, just touching what is pediatrics. Typically, if you go to your doctors, you get kicked out of the pediatrician's office by the time you're 18, maybe 19 if they really like you. In craniosacral therapy, we believe that the system matures somewhere around 7, maybe 8, 9 years of age. So usually we're looking more at the system itself for children that are under 7 or 8. Of course, there are so many children between that age and adult age where, depending on what kind of medical concerns you have, depending on your growth rate, developmental rate, you may fall on on a continuum between a child and an adult as far as your development, whether that development is physical or emotional, mental. So, and either ways, if you look at pediatrics, we're not mini adults. Children are not mini adults. They're not just miniature sized adults. Their bodies are still developing, their minds are developing, their emotions are still developing. So what does that mean to us? When we start treating children, our approach and the treatment that we offer differs based on their age, based on what kind of stage of development are they at this point. So if you were taking pediatrics from a craniosacral perspective, there's actually 3 levels of classes at the Upledger Institute where we develop your skill, we develop your palpation of the craniosacral rhythm, help you learn some basic foundational techniques, and then we work our way to develop enhancing your skill level, your palpation techniques, your presence, and then we help you almost work your way down in age. So when you think children, especially toddlers, they could be moving targets. Craniosacral rhythm is a very subtle rhythm. And when we start learning how to treat children using craniosacral therapy, or actually any kind of therapy, you have to learn as a therapist how to engage these children so that it doesn't turn into a chasing around the room kind of hour for you. They're very sensitive. Their inner systems are sensitive. Their tissues are more sensitive to your touch. In craniosacral therapy, we talk about their inner wisdom, the inner physician, and that inner wisdom has a more subtle voice for children. So it's really important that we as therapists have to increase our skill level so that we can be there to listen, to blend and understand these children so we can meet them where they're at. We can understand why they're feeling what they're feeling or why they are at the developmental stage that they are at. In order to understand a child's perspective, we usually talk a lot about their neurology. We talk a little bit about development, and that development could be motor development, cognitive, social, or emotional stages. And all of these developmental stages, these perspectives that children have about themselves, about you as their therapist, their environment, their caregivers, all of that depends on the neurology, on their development, and what stage of development are they at currently. Usually our perceptions are perspectives of life. They are developed because of our life experiences, right? If you were in a car accident, the next time you get into a car, there's going to be a little something that you're going to take with you when you're driving for the first time after a car accident. The younger a child is, the closer their experiences are to birth, to in utero life, to maybe early early life, the first few months of life. And all of these perceptions, their belief systems, seem to gel around that time. So it's a very critical time of life for all of us. And it's important to recognize that as therapists, if you're working with these children, or even with adults, actually, because all adults have been children at some point in their lives. And we tend to forget that. The other thing that you have to pay attention to when you work with children is family dynamics, right? Children don't live alone. They don't drive themselves to your therapy clinics. They do not drive themselves back, and they don't take care of their own selves, depending on their age. And so it's really important to pay attention to what the family dynamics are. How's the bonding? Is there bonding or not? What kind of issues is this caregiver coming in with that they themselves are dealing with? And now that has an effect on the child or the children in the family. These days, we're all busy. Everything in life is go, go, go. So there's a lot of frenetic energy that's kind of present in homes around, nobody sits down to have a meal together anymore. It's not a more laid back life like when I was growing up back when. But so the energy that this child is growing up in, that's in his environment or her environment, affects this child's neural regulation, which affects how they organize their systems. So it's very important to have an idea of what that might be like for the child. Now, there are children that will come to you with structural issues. There may be things like plagiocephaly. You see the top of this child's head where there's flat spot on one side. That's called plagiocephaly. And so a lot of times they hold tension patterns. It could be because of pressure in utero. Maybe this part of the child's head was resting against mom's pelvis somehow, in the last couple of months of pregnancy. And that's the tension that presents itself. Now that's how the head molded itself. It could be for deeper tension patterns that are within our bodies on the inside that are pulling on the cranium and creating, kind of facilitating that type of head shape. So we need to figure out what is the cause of this issue. It could be that that little kid is a container baby. That's my word for it. But the more prosperous we get, the more things we have. The baby goes from a car seat to a swing to a some other kind of swing. And so now the baby's head is constantly being pressed into the surface and gets flat. We hear a lot about tongue ties. All of us have a little slip of tissue that helps connect our tongues to the floor of the mouth. But there's many reasons, and I'm not sure that this is the place to go into a big discussion about why we have tongue ties, but because I don't think we know 100% that there is just one cause. I think there's a lot of different reasons why some children are born with a more midline tissue than others. But irrespective of that, when you have tension in your mouth, in the floor of the mouth, in the cranium, in some other part of the body, that has an effect on how you grow, how you function. And when you have to function, we all have to eat, we all have to move, despite all of these things. So when the children have to do that, that builds and develops a lot of strain and stress in their systems. So it brings me to another issue that we really can't talk about pediatrics without talking about sensory processing. Sensory processing disorders are way more challenging than most people recognize. And if you think about it, it's a stress disorder. It's when a child is just overwhelmed or maybe underwhelmed with the information that their senses are picking up from the environment. And depending on how they process all of this information, um, it can lead to a lot of strain internally, which they're constantly working against these these challenges. And when you have stress in your system on a chronic basis, what happens? Our nervous system doesn't function well under stress. So you will have a nervous system that starts shutting down or even breaking down. And when that happens, now you could have burnout, physically, emotionally, mentally. You could have, your immune system kind of fatigues out after a while. And so these are the children that are more sensitive to food, different allergies to foods, or just sensitivities to textures, to sounds, different types of, you know, things that normally other people could just ignore, but they can't. And their system now with children, their system is still developing, so they are working their body is kind of working around all of these challenges and developing around all of these challenges. So that could be different for each person. I want you to think about having a day where you have a bad headache and how that affects how you function, or having a stocking that you put on with a twist in your stocking, and how do you function around that if you could not take that stocking out? Can you actually go through a day full of meetings, a day of work, a day of driving your kids around, and you cannot change that discomfort? How does that make you feel? And then now think about a child that is not able to express it, is not able to change this, and has to go to school every day and learn something new. Your system is not able to learn when it's under chronic stress and shutting down. So one of the most important things, one of the most basic needs that we have as human beings, and especially children even more than adults, is the importance of feeling safe. So with craniosacral work, we learn how to create this sense of safety for children. And if you don't feel safe, you're not doing anything, right? If you have an 18-wheeler that's coming at you, a saber-toothed tiger that's chasing you, you are not thinking calculus. You are not thinking about organic chemistry or learning your alphabets. You're thinking about survival. And that's what happens is when their systems are under stress, whether that stress is physical, emotional, structural, sensory, whatever that stress might be from, it's up to us as pediatric therapists to learn how to create a sense of safety with our presence, with our touch, with our environment in order to facilitate change. So talking about actual treatments. What exactly is craniosacral therapy? If you define craniosacral therapy in our textbooks, it's defined as a very gentle, hands-on technique, and it's used to detect and correct imbalances within the craniosacral system that we just got a glimpse of. If you come in for a craniosacral session, the person's fully clothed. Usually the sessions might be quieter, but it doesn't mean that they always are quiet for, especially not with children, because when you're working with pediatrics, when you're working with little ones especially, it's more of a, we would be, you're not laying quietly on a massage table with candles and soft music. You might be in a more brightly lit room on the floor with toys and working through that, which is again brings me back to why we need to work on developing our skill before we get to the pediatrics. aspect of craniosacral therapy. For adults, most of them are just laying on the table unless you can't lay on the table, in which case cranial can be done in any position. With children, they don't usually lay down on the table at first, especially the toddlers, or it would like to be more upright. They're maybe on the floor, they're playing. Some children might be in their parents' lap or in your lap as the therapist. They might be breastfeeding if they're even younger infants. So the positioning could be any, you could be under your massage tables. So the positioning is whatever works for you as the therapist and for the child in order to get through a session. Usually we start with evaluating, and with children, the evaluation and treatment is a more blended approach. It's not like a separate evaluate for so many minutes and then go ahead and treat for the rest of the time. The evaluation and treatment are intertwined with each other. And it's a very, very gentle approach. So if you look at when the parents are watching you, all they will see is you with your hands on the child. And it looks like watching grass grow. It's very boring to watch. But what I tell parents is, they always want to know, well, what does this feel like for my child? And I'll say, if I have my hands on a big pat of butter, I feel nothing if I just took it out of the fridge. However, if I wait for a while and things start melting under my hands, and what happens? My hands feel like everything's softening under them, spreading, maybe sinking in. And that's how I describe some of the releases or some of the sensations that I might feel as their tissues balance out. It just gives the parent something to relate to. What can you expect after a session? The child might sometimes be sleepier, more tired. They might be hungrier. I don't give out like a list of what you can expect. I usually will say, you know what, you might expect anything. Anything that, it could, and I'll give a few examples like, oh, maybe they're hungrier, maybe they're sleepier. But other than that, I just say, if you have any changes, just you can blame it on me for the next 24 hours. As far as frequency of treatments, we usually see children. I like to see them if there is a specific concern that they're coming to see me for, I'll say once a week. If it's just more for wellness and to maintain something that's more chronic, it could be longer periods. It could be once in 2 weeks, 3 weeks. For infants, if they're working on breastfeeding, it might be 3 times a week, because we could do 3 times a week for 2 weeks and we're done. Not necessarily for every child. Please don't quote me on that. But definitely, you could sometimes, so it depends. The frequency of treatments would depend and differ between each case and why they're at your clinic. Usually I might start out with a higher frequency for the first couple weeks, and then as their bodies start responding, we increase the gap and make sure that things are still progressing. As far as the approach with craniosacral therapy, if any of you have done any type of fascial release type of work, any type of fascial work, we talk about direct fascial work where they basically just stretch the tissues that don't want to be stretched. But craniosacral is more of an indirect fascial release. So it's more of a gentle approach. We're not forcing anything. It's one of those techniques which is more passive in its approach. Usually we are all taught to fix. With cranial, we facilitate a release. So we learn how to tune in to deep-seated tension patterns within the body. And then we train a lot to figure out how to support this body and to support those tissues in releasing and balancing themselves out. And we facilitate that. very, very light touch. And if I were to give you an example of how light that touch might be, it could be as light as if you were to touch a leaf that's floating on a lake or in a bowl of water, and try to move that leaf on the surface of the water without making it sink in. So it's really, we talk about 5 grams of force, very light touch, but that doesn't mean that we hover. We're still blended with tissues. The only reason that touch is so light is because you don't want to elicit a defensive response from the tissues. So very important to keep your touch light and work with the body when you're using craniosacral therapy instead of determining in your mind what it is that you want to do for this person. You say, well, what does that do? Well, craniosacral usually helps us balance our autonomic nervous systems. We have a part of us, our nervous system, that helps us survive, helps us flee, fight or flee or freeze in the face of danger. And then we have our parasympathetics, which helps us sleep, digest, rest. And we need a balance between both. Most of these children that are going to come to you, that you will see when you start doing pediatrics, they all tend to be mostly in sympathetic. I would say some teenagers are almost in parasympathetic, but it might also be a sympathetic freeze. So balancing that out using craniosacral therapy kind of helps facilitate optimal health. What we're doing is we're releasing these deep-seated fascial tension patterns that might be interrupting the flow of the cerebrospinal fluid. Remember, when I started talking, I was talking about how this fluid basically nourishes your central nervous system. It brings nutrition to your brain and your spinal cord. It takes away waste matter. It helps our nervous system function better. And when our nervous system functions better, everything in our body functions better. So when you have decreased irritation, decreased hypersensitivity in the nervous system, it has a better tolerance for everyday information that's coming in. We are being bombarded with sensory information every second. And our nervous system has to figure out how to adjust and what to pay attention to, what to ignore. If there is a sound in the back behind me, I don't stop talking to you to go check that sound out. I can shut that out of my conscious mind. If I have an itch, I don't sit here scratching my back. And so it helps improve your tolerance and figure out what kind of information can your brain consciously pay attention to, and what can happen at a more subconscious level increases that buffer for you so that you don't you don't hit your ceiling. Now, going a little bit younger, talking briefly about infants. If you think about birth, right? Do we have to? Yeah, we're good on time. If you think about birth, when a baby is born, and I'm talking about normal textbook perfect birth, the baby read the textbook, it's coming head down through the birth canal, the occiput is anterior, pivoting under the pubic bones coming out. A lot of times as the head is born, it has to extend, the head has to extend back as for the body to be born and rotate a little bit as it comes out. And a lot of times what can happen based on a lot of different factors is that there's a lot of tension pattern things get tight back here. The muscles may be tight, the joints may be a little bit tensed back there. And there's a few openings in that cranial base area. One big one is called the jugular foramen. There's also a couple of canals on each side of the jugular foramen called the hypoglossal canals. And a lot of major cranial nerves come out of these openings. When you have tension at the cranial base for a little one, what happens is the fluids that are flowing through your blood vessels that come out at that level, the fluids, your lymphatics, the messages that are going through those cranial nerves, all of those are interrupted. So the efficiency with which these nerves and blood vessels function is now compromised. We have some very important nerves that come out at this level, right? So if you think of your cranial nerve 9 and 12, they really innervate all the structures that are in your throat, in your mouth, the tongue. So it affects how they latch, how they swallow. If you have cranial nerve 10, that's your vagus. The vagus nerve is called the queen of parasympathetics. And it can affect a child's reflux problem. It can cause constipation or diarrhea or irritable bowels. It can cause a colicky, for you to have a colicky baby on your hands. If you have the cranial nerve 11 is a big one, it's a motor nerve, and that will, if it's compromised on one side or if it's irritated on one side, now the muscles that it innervates are tense. And you take your child to a physical therapist because my child is only comfortable looking left, can't look right, or it's tilting its head to one side, is not able to look the other way. What happens? The child, I mean, I did this. I'm a physical therapist by background. You stretch the muscle that's tight. That's what we're taught. The child's crying, the mom's crying, the therapist never enjoys that. And is it helpful? Sometimes you're breaking through fibers, you're overstretching a tight muscle, but in the long run, it's never 100%. And if this cranial nerve 11 has been compromised back here, it's firing constantly, right? It's irritated because of the compression. So now it keeps sending signals to the muscles to tighten back up. So your stretches may not hold for a long time. So you could have a child that's colicky. You could have a child that has reflux, that has torticollis. Torticollis is when your head gets kind of pulled to one side, you have trouble looking both ways evenly. The head might be tilted to one side. When that happens, now this is a child that doesn't even have head control yet. So you're going to get their little soft skulls are going to get a flat spot because they're constantly tipped to one side and turned to one side when they're laying down on any surface. And the longer they lay in a surface, the flatter their heads get. You could have a child that has GI problems. So all of these issues, again, I'm not throwing out diagnoses, but these are just examples of things that you might come across and that you can actually release if you work, if you learn how to use craniosacral therapy for cranial base area. So you might have a child that has trouble breastfeeding because of tongue tie. So if you have somebody that has a tongue tie, I want you to think about the entire body. It's not just under the tongue. Our tissues are all connected to each other. So you have, the song where your ankle bone is connected to your knee bone, to your hip bone. It's true. We have everything in our body connects to everything else. So this is a child that may have trouble in, tense jaw or tension in the neck that's kind of flowing to the floor of the mouth and under the tongue, affecting how the tongue comes out, to kind of latch on. It could be tension further down in their torso or further down even in their legs that's causing that tongue to have issues with breastfeeding. Sometimes you will have a child that has already had the tongue tie released, which is called frenotomy or frenulectomy. And using craniosacral techniques, we can help support tissue relaxation so the body can be as balanced as it possibly can before and after a procedure like that. It can help the child's system calm down, his nervous system calm down a little bit after the trauma of having that released. So there's a lot of benefits to learning how to do craniosacral therapy. It has changed how I practice for sure. Anyways, staying on topic, craniosacral therapy, the children, like we said earlier, they don't drive themselves to therapy. So it's always helpful to help offer this technique for parents, for families, for the other siblings. A mom that is in postpartum depression or still recovering from having the baby might be struggling with their own issues and it makes it that much harder to care for a newborn. So it's really helpful to learn how to, support the entire family using craniosacral work and not just the baby itself. The more relaxed the mom is, the easier the milk supply, the better the milk supply, the better she is able to take care of the child. And children pick up on their parents, their caregivers' stress levels, and they will mimic that for you. They will show you your own anxieties, your own stress levels. So the calmer the parents are, the more we can facilitate that calmness, the better chances for the child doing doing well in therapy. So I want to leave you with this thought. Okay, this is one of my favorite quotes. Don't look at their dysfunctions. Don't look at their limitations. We're always evaluating for what they cannot do. We're so focused on all the things that are wrong. How about focusing on what they can do? Where are they at? And then let's meet them where they are at. Craniosacral therapy can change the way a child eats, sleeps, grows, moves, and learns. So why not wait, why not learn how to increase our own skill levels? Why wait for a child that has a torticollis to now grow up and have bigger issues, more complex challenges, increased patterns of compensation, behaviors that get worse and worse because there's layers and layers that they have developed, habits that they might have picked up in order to survive and adjust around whatever challenges they have. So why wait? Let's improve our skills in being able to work with children at a younger age and facilitate optimal, I would say, optimal growth, help them reach their maximum potential. Okay, I believe in that a lot. You can see how passionate I am about that. These are just a few references. There's tons of references on pediatrics, on craniosacral therapy. These are a few that I think might be helpful to you, some books, some websites. I want to point out the last one. That is the Upledger Institute, or IAHE, is International Alliance of Healthcare Educators. And that website has a lot of just articles, case studies, and research that is related to craniosacral therapy. And the reason I'm pointing this website out is because they update it. So as new research comes out, or maybe somebody posts a new article, they will update that website. And so that's always a good current resource for you. I want to thank Dr. John Upledger. I feel like we're taking one man's work forward. If he hadn't done so much research, opened this modality up to non-physicians, I wouldn't be here today. And I don't know, I think it's like over 100,000 or 150,000, somewhere in that range, people around the world who are working with craniosacral therapy. None of us would be here without Dr. John Upledger and Upledger Institute. So thank you for that. Of course, thank you to Biotone and for hosting these EduTalk series, and to Donnell for having me here again. And Jackie Halderman, I don't know if you're still here, but thank you. Always a pleasure to see you and chat with you. But if you have any questions, I'd be happy to answer them right now.
Well, we did have a lot of questions and comments come in.
Okay.
And I wanted to start with the research,
Here.
which which can be found on upledger.com. And to go a step further with that, if you look under resources tab and then under research sources, articles and case
Research articles
studies.
and case studies.
Thank you. My
Yeah.
phone closed down, so I couldn't see that.
Okay, yeah.
Yeah, so I did see quite a few, and I'm going to now read through the different chats, but I did see quite a few asking about supportive research to this. So first,
And
we'll start
Donnell,
with,
excuse me, let me just add in what Binaifer just said, the way is just another way to get to the same research page you just mentioned. So
okay.
there's two different ways you can get to the same spot.
And Binaifer, maybe you could put your way into the chats so folks can see that.
But what would you
Oh,
like me
she
to?
already mentioned it. It was
Oh,
on,
okay.
it was on the PowerPoint. This, when she said AHI, International Alliance of Healthcare Educators, that was just another way for people to see how to get to the research. And again, if they just go to upledger.com under resources, and then under the research case studies and articles, you'll find all the research that we have. And like Binaifer said, it is constantly updated.
That's wonderful to know. And for everyone that hasn't participated with EduTalks previously, tomorrow you will receive a follow-up email, and in the email will be a recording link and a copy of the PowerPoint, and it will have contact information for Upledger Institute. I will also include the link to the research page that both Jackie and Binaifer have referenced. So watch your inbox tomorrow for the follow-up. If you do not see it by noon, feel free to just email me, but check your junk folder or spam folder first, because the emails often end up in spam or junk. Now, at the beginning of the talk, Daniel asked, what experiences do we have with severe traumatic brain injuries? And it was right as you started your presentation. So I'm not sure if that is applicable to the pediatric side of things.
Well, it could be applicable to anyone, right? Anybody could have severe traumatic brain injuries, including little ones, children. So yes, it is applicable. It, again, I wouldn't say take a weekend workshop and start with the most medically complex person. You have to, it takes a lot of practice to develop your skill with this approach. So give yourself that time. Start with working on children that have no challenges. Get practice with that, and then work your way into more complex situations. But definitely, I have had good success. It helps, you know, it helps support their nervous system. And so, what other modality would you say actually facilitates and supports, if you're thinking brain health, I mean, how much better, what other modality would be better than craniosacral therapy for somebody that has brain injuries. I think it's a traumatic brain injury, the person needs not just one modality. They might need physical therapy, they might need occupational therapy, they might need psychotherapy, they might need, you know, it's a complex situation, and depending on how severe, what part of the nervous system has been injured, how long ago was it injured. So it would be, you'd have to look at it from an individual perspective, but I think overall it would help for sure. To
Thank
what
you.
extent is hard to know.
And I would like to add as well that watch your inboxes over the next week for an email from Upledger Institute on their courses and workshops. And please note that you just don't jump in to a high level class. There are the, let's say, 101 classes to begin with at Upledger Institute, and understand there and grow from there. So
Donnell,
again,
thank you. There are definitely prerequisites that somebody has to take before they get to the pediatric level.
yes. And so watch your inbox for that from Upledger Institute. All right, so let's go on with the questions and comments from James. Many high-profile therapists on the internet, such as Adam Meekums, claim that osteopathy and craniosacral therapy are merely placebo effects and lack sufficient academic research, making them non-evidence-based practices. Do you also believe osteopathy and craniosacral therapy are not evidence-based methods? How would you defend yourself against these claims?
Well, I don't know where, so let's, I don't know, then do we have another hour to talk about this? I've been doing, let me say this. I completely believe in osteopathy and craniosacral therapy. Just like any profession, I think, or any modality, I think this modality is only as effective and as powerful as the person who you go to. You have good doctors, bad doctors. If a person takes a weekend class and goes out and says, you know, I've had patients that come to me and say, well, you're not putting hot stones on my back. I'm like, well, that's not craniosacral therapy, but somebody said it was. And that's what they went in for a session without knowing. So yes, I feel like the science is catching up to what we already can feel and know, and we're learning how to explain it in more scientific terms. There definitely needs to be more research in understanding why we feel what we feel and why it's effective. But I just want to say that I have been doing this for over 30 years. This is 2025 is my 30th year of doing craniosacral therapy. That's when I took my first cranial class, was in 1995. So if I didn't believe in this, if this didn't work for the clients that I see, I would not be doing it this long. I never intended to go in and start teaching it. I just took it because I'm a physical therapist and I was curious about somebody talking about this kind of weird stuff. So I took a weekend workshop, and I kind of understood it. I maybe didn't. And I just started using it with my patients because when I would run out of what else to do, and they would come back the next day and say, whatever it is that you did, can you do that again? Because it made a huge difference to how I feel. So I definitely believe in it. It works. But again, it depends on the skill level of the therapist. Unfortunately, unlike a PT school or an MD program, that it's not a degree. It's not like a curriculum that's contained within a few years that we test out of, right? So you could stop at any point. You could take as many classes as you want or not. And that's the type of therapist that you'll get. So I say go to the people who don't believe in it, try it out for yourselves. Don't just read articles on Google.
All right, so thank you. And Selena's asking about many studies have shown cranial bones do not move and that they fuse over time.
Yes.
And you're not claiming that they can move or
No.
exhibit, and that they don't exhibit movement.
So the studies that they're talking about talk mostly about the cranial base. There is some level of mobility within some of the sutures, the sagittal suture, temporoparietal sutures. There is some like microns of movement. What we're feeling is these bones are what? They're connective tissue, right? And we have fascia that connects to these tissues. We have other membranes that connect to the bones on the inside of the cranium. So when we palpate these bones, we're not just on a hard plastic skull. We're not on one bone. We're on different structures that evolved over time and came together. And so the different fascial attachments and the strain patterns that you feel in the body are felt through these tissues. So no, they don't, when we talk about the rhythm, we gesture like so. But if our heads moved like that, the brains would fall out. So no, that kind of movement is very subtle.
All right, thank you. Jackie, this next question should be something that you include in your follow-up email from Upledger. Aldine is asking, which are the 3 prerequisite classes you are recommending before working with children? So if you can make a note of that and include that in your email, I'll go on because we do have quite a bit of questions. Sarah is asking, osteopaths and craniosacral therapists claim to feel movement in the fluid within the skull. I'm not sure if you just addressed this.
Can I,
Yeah.
sorry, complete the question, sorry.
Okay. Research indicates that such subtle circulation cannot be perceived by human touch. What do you have to say about this? Can you provide a high impact study or research?
So I would say, just following up with what we just talked about as far as skull bones moving, we learn how to palpate the subtle rhythm anywhere on the body, not just on the skull. And it's the tissue response to the different rhythms. Why is it that you can go to I forget what they're called, the people who, who can tell you, they can take a sip of wine and tell you what kind of year it was from and what kind of, soil, what the soil conditions were in those at that time. Why is it that that's okay? And our hands have, oh gosh, I want to say not thousands, but almost millions of receptors in our fingertips and in our hands. And if we can train to feel subtle things, then we learn how to palpate that. If we don't, then we don't. I mean, medical doctors can feel through your belly and tell you what your liver feels like. You and I might not be able to do that if that's not our training. So I feel like the more you train and the more you work with tissues and with these subtle rhythms, you definitely can train to feel these and palpate the different tissue tension patterns, the different rhythms that our bodies have. As far as the high impact research, again, I'll kind of refer you to that website because most of the recent research is on that site. So take a look. And unlike pills, you can't do double-blind studies with body work. So no, those kind of so it's a different type of research that you'll find. Double-blind studies are for medication. If I'm a therapist, I know whether I'm just sitting there touching you or am I actually doing something? So it's a different type of research, but yes, there is research for this. Hopefully that
Okay. Daniel has, I'm not sure if I understand all the typing in this, but he's a DO, and he said during a lower back surgery, he was a first assist. He repeatedly saw movement of both the lumbar fluids and nerves
yeah.
at the flow approximately 54/5 repetitions per minute. And
54 repetitions?
54/5 repetitions per minute. And then he has another question. Yes, gentle techniques with pediatric points, but I'm not sure. And this is where the typos, I'm not sure. Uplinger demonstrated to me to equal the pressure of a frozen skull section to get a release. For adults in car accidents, I have used 10 to 15, and maybe it's supposed to be pounds, if that makes sense. Pines? Okay. So I think those are comments, not questions. Tommy, many studies suggest that the effectiveness of craniosacral therapy does not go beyond the placebo effect. Besides patients' subjective reports of improvements, do you have any objective and measurable psychological evidence supporting its efficacy? And again, that would probably be on the research and case studies section of the UpLedger website.
Yes.
All right. Let's see.
You know, can I
Natalie,
say something about placebo effect?
yes.
The reason we use placebos in any kind of double-blind study is because it's always effective, and sometimes more effective than the medications themselves. And if I'm not wrong, it's about 30% placebo effect. So even if it is placebo, I think it's very helpful. I do feel like we underestimate the power of touch and how effective that can be for our nervous systems and our tissues. And sometimes that's all it is. And maybe that's all that our nervous systems need to put us into that parasympathetic to help calm the nervous system down a little bit. And but I do think there's, as you go up in the level of, you know, in developing your skill level, I think there's a lot of techniques that are indirect, maybe even direct techniques later on that are very helpful, that are beyond placebo.
All right. And Nathalie is asking, what are the best ways to integrate craniosacral therapy with manual therapy, osteopathy, or physiotherapy? And which patient groups do you observe greatest synergy?
That's a good question. So I'm a physical therapist by background, and I still practice as a physical therapist. In fact, I do a lot of vestibular rehab, and I would say, as far as manual, I mean, craniosacral therapy, it's a form of manual therapy, right? It's a hands-on technique. So if you have any person that has, you know, pain, any person that has challenges with fascial restrictions where you are thinking stretch or strengthen, well, not strengthen, sorry, I take that back, but where you feel like, okay, I need to stretch this. If you have somebody that has nerve pain, radiculopathy, right? I have shooting pain down my arm, sciatica, shooting pain down my leg. I have a toe walker. You know, I have a child that is colicky. I mean, I can integrate craniosacral therapy into my practice very easily. At first, it was challenging because I was thinking of it as a separate modality from physical therapy, from this, from that. But as I started, instead of me deciding what to do, once I started looking at the my client, what I needed to do for them, what their bodies wanted, really just, it flows, it blends very easily, and it changes. Yeah, it's changed the way I practice. It's changed the way I feel a person's body, how I mobilize somebody's joints has changed, the pressure, how I view their system has changed, how I view their complaints has changed. So I feel like it's integrated really well in my practice. I usually, if I'm doing other things, I might put it towards the end of the session because it's such a calming technique that if I'm integrating it with, say, balance exercises or strengthening type of exercises, I would use craniosacral work at the end of my session so they can just leave feeling better.
Thank you. Nicholas is asking, where can he get more info on pacemaker theory?
Probably on that same website.
Okay.
Yeah, and I actually just put that in the chat. It's a button right below the research flyer button on the research case studies and articles tab.
Thank you for
Okay.
mentioning that. Aldine is saying she's currently working with a teenager recovering from TBI, and we've
Okay.
been working together for 18 months using several modalities. And Daniel is suggesting not to forget to try PEMF and microcurrent, Avasia. Their businesses in Dallas, Texas. And let's see, a peer-reviewed journal, the Journal of Osteopathic Medicine. And Jennifer is asking, yes, sutures are fibrous joints, therefore little to no movement. Comparing craniosacral therapy to sommelier. Aldine loves it. I'm excited to attend the CSTP in May in Edmonton, Canada. Let's see what we have here. Having difficulty locating any info on Rasmussen pacemaker theory and in research articles on Upledger website. Please point me in the correct direction.
The link was in the handouts that you guys received, and the Donnell, you suggested the same different way of reaching the same
Yes.
page.
So
it's
that will, again, that's in the PowerPoint that will be attached to the follow-up email tomorrow.
Thomas Rasmussen is he used to be in Denmark. I just recently heard that he's moved to Finland. He's published a paper on the third rhythm, the first two being your cardiac and your respiratory rhythm. So there is a paper published out there, and it should be again on that AHI website that was in your handouts. He's the one that's come up with the pacemaker theory. But again, just like all the other theories over the last 100 years, it is a theory. So we're trying to keep current and understand what we feel and get a more scientific basis behind that.
Okay. Well, this is officially my longest Edu Talk ever. And thank you so much. Again, everyone, thank you for your participation and interest and excellent questions. And please join us again on April 8th. I'm not sure if you're familiar, we have Edu Talk Diabetes Series. And excellent information. We've had massage therapists present, dietitians, nurses. And on April 8th, we have Michelle Plummer presenting on the benefits of exercise for type 2 diabetes clients. So this is good information to share with those that have diabetes. And that will be again next week, April 8th. Then on April 15th, we have a past presenter, Dale Alexander, teaming up with a new presenter, Anne Brahmin, on the fluid connection, the brain. So please watch your inbox for RSVPs, and join us. Actually, the April 15th, the fluid connection, the brain, the RSVP will open tomorrow. So thank you so much, everyone. Join us again. Visit the archive library. We started the EduTalk series in July 2020. There are numerous craniosacral therapy presenters and topics that you can find there, as well as excellent topics from other educators in the industry. Thank you. And again, watch your inbox for the follow-up, and over the next week for the upledger.com follow-up. And just thank you for everything you do out there. With that, be safe, take care, and we'll see you again soon.
Thank you, everyone.